Hi, I'm Lindsay Bennett, President of Conrad Healthcare, and today I'm going to tell you about how to get free medical practice market data. What we're going to look at today is called the Provider Utilization Files, or PUF files, which are on the cms.gov website. And I'm going to show you how to navigate to those and how to query it to get the information that you want. Now, these files are really cool because they include individual physician claims. They can be sorted by zip code and city and state, by specialty. They show you all the CPT codes billed for those physicians. And I want to just start off by giving you the two limitations of the data that are big ones to keep in mind. One is that this is Medicare fee-for-service data. It's not all payers. The commercial claims are not in there, but that may be okay depending on what your purpose is for the data. So for example, I use this data to estimate market share of one physician relative to another. And as long as the Medicare payer mix is fairly consistent between the providers in a particular area, then it can give you a good approximation because you can sort from high to low on the number of beneficiaries that each physician treats and get a ranking of who the highest volume and the lowest volume physicians are. The other thing you can do is if you know your Medicare payer mix and if it's reasonably consistent between providers in your community, then you can do what I call grossing it up to figure out what the total number of patients is. So for example, if you know that Medicare is 50% of your payer mix, if you divide that number of patients by 0.5, then you get your total number of patients. So again, assuming that this is consistent, in your market. Obviously, if you're running a 100% concierge practice, then that's not applicable. The other limitation of this data to be aware of is that because it is government claims data, it typically lags about 2 years behind. So the file that we're going to look at today is from 2017. Now soon it will switch over and it'll be 2018 data, but it's about 2 years behind. Now, if you're in a fairly stable market and you've had the same players year after year, then that's probably fine. Now, if something is changing rapidly, if you've had a lot of new providers coming into your community within the last 2 years, then you need to use it with care. So, again, it just depends on your situation. But remember, again, it's free and it's there for you, and it may be good enough for what you're doing. The ways that I've used this are, like I mentioned, to figure out market share. Another way that I use this data is for startups. When I'm doing a pro forma for a new medical practice and they're trying to figure out which CPT codes they're going to be doing, I can query all the physicians of that specialty in that area and look at their claims data and see what they're doing to get an idea of the procedure mix. So that's another way that it's helpful. The other way that I've used this data before is to, for a particular specialty, if I have a provider, let's say that they are a gastroenterologist, I can look at what they've billed in a year, and I can look at what their competitors billed. And they may have a couple of services that their competitors are offering that they're not. Or a lot of times I see this with family practice or infectious diseases. Their competitors might bill for more things than they bill for, and we find a new billing opportunity. So there's so many ways that you can use this, and those are just a few of them, and you may think of additional ways. So now I'm going to show you how to get to the files and how to export the data. As you can see, we are at cms.gov, and I'm going to show you how to get to the various data sets from here on the homepage, and then I'll show you a quicker way to get to what you need. Right now we're going to go to this gold bar that says Research, Statistics, Data, and Systems. I'm going to click on that. And it takes me to this page, and I'm going to scroll down to where it says Statistics, Trends, and Reports. And you can see there's a lot here. I'm going to keep scrolling down. And today we're going to look at the Medicare provider utilization and payment data. So I'm going to click on that. And over here in the left-hand column, you can see it says provider utilization and payment data, physician and other suppliers. Today we are looking at a medical practice example, so I'm going to use this data set. But you can see over here on the left, you also have inpatient data. There's Medicare Part D prescriber data. There are other data sets here that may interest you. There's post-acute care and hospice if you work with one of those providers, and I'm going to do a separate video for that. But today we're going to click on the physician and other supplier link. So now we're looking at this list of data sets, and you can see they're sorted by year. The most recent one right now is the 2017 file, and it's May right now, 2020. Typically, these data sets are about 2.5 years behind. That's one of the weaknesses of using government data like this, is that it is claims data, and there is a lag time on it. So this would affect you if you're in a market where you have a lot of new providers coming in and setting up shops, you have rapid growth. Those things would make this data set less useful for you, but if you're in a mature market and it's pretty much the same players in the last 2 years, then you're probably fine using this. So I'm going to go ahead and click on it. And if I scroll down, you can see there's a link to the interactive data set. And that is what I'm going to click on. And it's called a PUF file, P-U-F, Provider Utilization File. That's a good way to find it if you were going to look it up. I'm clicking over to Google right now. The shorter way to get to this is just to type in CMS physician, hang on, CMS physician PUF data set. If I put that in, it's going to take me there, and I have a link and it'll take me directly to it, so you don't have to go through all that navigation. So that's a shortcut. In the data set, like anything else on this Medicare site, whether you're looking up prices or a fee schedule, you always have to accept the CPT licensing agreement. So I'm going to go ahead and say okay, agree. And I have arrived at my data set. So if I scroll down a little bit, you can see here are the columns in this data set. So we have the NPI, first and last name of the provider, the credentials, that's going to be whether it's an MD, a DO, a nurse practitioner. We have gender. If we scroll down, I can click this link that says show all. It's going to give me the addresses, the zip code, the provider type, that's the specialty, place of service, and it will actually give you, it's got the HCPCS codes here, so it gives you their CPT activity for that time period, the calendar year 2017 as well. Number of distinct Medicare beneficiaries, charge amounts, payment amounts, etc. There's a lot of data in here. I'm going to go back up to the top, and I've got this blue button here that's highlighted that says view data. So that's what I'm going to do. I'm going to click on that. And here is my starting data set, which is huge. It's got everything in it. So you can see up here we have some buttons, we have some options. The ones that we're going to use in this example are the filter button and the export button. So I'm going to filter to just the data that I want, whether that's a city or a certain specialty or both, and then I will export it to CSV so that we can bring it into Excel. One other thing I wanted to show you while we're here, I'm just hitting the back button. But there's an option if you want to work with your data live on the screen. There's this visualization tab, and you can create visualizations such as graphs, bar graphs, scatter plots, etc. right here. You have to create a login to be able to save your visualizations, but you can do that here. And then alternatively, you can do what I just did, which is to click on view data and query the data you want and then export it to Excel. So if you're more comfortable manipulating it in Excel, that might be your first choice rather than using their tools right here on the site, but you do have both options. For today, just to demonstrate this, I'm going to query orthopedic surgeons in Sarasota, Florida. Now, if you're doing this for a competitive analysis or for a business plan, you may want to bring in other surrounding areas. You want your true market where your patients are going to come to the practice from. So if I were doing this for real today, I would not just pull in Sarasota, but I would also include Venice and Inglewood, Bradenton. It just depends. So what I recommend is if you're going to do this beforehand, you need to define what it is that you want to look at. If you are doing an analysis on primary care, you may want to think about how to define that in this data set. As I'm going to show you, that could include internal medicine and family practice. So I would suggest that you basically jot down what it is, what's the question you're trying to answer, and figure out what you want to query before you start. But today I just want to demonstrate how to do this. So I'm on the screen where it says filter. I'm going to click on that and scroll down. And all the filters, as you can see, they correlate with the headers and the columns I showed you earlier with the data. So I'm just going to go through them, and I'm going to filter on city, and I'm going to filter on provider type, which is also known as specialty. I don't care about filtering down on the NPIs, so I'm going to skip that. I'm not pulling a particular surgeon, so I'm going to skip the last name. Here's the HCPCS code. So, for example, if you wanted to just look at a particular procedure and who is doing that procedure in your market, so let's say you wanted to look at rotator cuff repairs, you could actually query on a particular CPT code here. Now, that's not what I'm doing today, so I'm going to skip that. And I have to click this button that says Add New Filter Condition. So every time I click that, I'm moving along these column headers here. So I'm just going to keep going through until I get to the ones that I want. Credentials of provider, that if you wanted to just pull doctors, if you only wanted to pull, say, MDs and DOs but not nurse practitioners, you could do that here by clicking on this box and putting in MD and then adding another filter that would include DOs. I'm going to go past the street address, and I do want the city. So here we go. Here's the city. And here I'm going to put Sarasota. But you can see it gives me several fields, so I could actually list multiple cities there if I wanted to. Oops, I closed my filter. Oops. Okay, let's scroll back down. There's my city I just put in. I'm not going to limit the zip code, but if you wanted certain zip codes, you could do that. I am going to put in state, and the only reason I'm doing that is if there was a Sarasota in another state, I don't want that. I don't think that there's more than one Sarasota, but I'm just going to put in Florida to be safe. And you can see it's thinking on the screen as I'm doing this. It keeps limiting the data set further and further as I put in criteria. I'm going to add another filter. And now I'm at provider type. When I use this field, there's this little settings option at the bottom, which you can see right here. I use this a lot because I don't know what the naming conventions are in this data for certain specialties. So there might be 3 or 4 different variations of cardiology. There might be interventional cardiology. There might be cardiology. So I don't know unless I check. So one way to do that is I can click on this options menu, and I can see show suggested values, and it will show me examples of what's contained in here. So for example, I mentioned to you earlier, if I wanted a list of primary care doctors that could refer to my orthopedic practice, I might want to pull internal medicine and family practice. So that's where it's good to look at what data is in here, because if I just pull internal medicine, I might be missing out on all the family practice doctors. So here you can see also I can use a very specific specialty name, or I can change this button here where it says is. I could say is not and exclude certain things. I could say starts with, contains. I use this contains filter a lot. If I don't know exactly how the specialty is described, I can put in ortho. So anything that contains ortho is going to come up now. I don't even have to spell out orthopedics. So that's helpful because I've seen orthopedics spelled P-A-E and also P-E-D. So this will take care of that. And I've filtered on everything I want to filter on now. So this data set has updated while I'm doing this. If I scroll over here, I should only see Sarasota. There it is. And I should only see orthopedics. You can see here orthopedics. So Now what do I want to do? Well, I've queried it. As I mentioned earlier, you can do a visualization. In this case, I want to export my data because I want to bring it into Excel. So I'm going to click Export, and it gives me a couple of options here. So these are the different file formats. I'm going to choose CSV for Excel. So I'm going to click that, and then I'm going to hit Open or Save, either way. And here's my data set that was exported. So this is just the raw data. And now I can create pivot tables, I can filter, I can remove certain things, but this is helpful. I've got my NPIs, I've got the physicians' names, and I can see all the different CPT codes of what they're doing here. You can see that here. So there's just so many possibilities of what I can do with this data. I'm going to save this. Okay, now that you've seen that, if you're not thinking, gosh, I love going to government websites and gosh, I love Excel and manipulating data in Excel, and you would like to outsource this and you'd like some help with this, I've put our website right here. It's www.conradhealthcare.com. And on our website, there's a free discovery call, which you can see the available times and actually just schedule yourself at a time that works for you. And we can chat for free about what you need, and we can help you with that if you want us to do that for you. If you want to do it yourself, that's great. And if you're interested in other training like this and tips and advice, we have a wonderful blog, and you can go to www.conradhealthcare as well and check that out and sign up for updates. Thanks for joining us. Have a wonderful day.